Samsca is a medication used to treat low levels of salt, sodium, in the blood, which can occur due to conditions like heart failure and certain hormone imbalances. It belongs to a class of drugs called vasopressin receptor antagonists. Samsca works by increasing the amount of urine you produce, helping your body to eliminate extra water. This helps to gradually increase the levels of salt in the blood to normal. It's important to note that different brands of this medication have different uses, so it's crucial to follow your doctor's instructions and not change brands unless directed to do so. The daily dosage and optimal timing for taking Samsca will depend on your specific condition, so be sure to consult with your doctor for personalized guidance. Before you start taking Samsca, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. It's important to not take this medication for longer than 30 days. To prevent dehydration, always have water ready to drink while taking Samsca. Drink when you are thirsty unless otherwise directed by your doctor. Use this medication regularly to get the most benefit from it. Remember to take it at the same time each day. Do not stop and restart this medication on your own. You may need to go back to a hospital to restart this medication. Tell your doctor right away if you stop taking this medication for any reason. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Grapefruit can increase the chance of side effects with this medicine. Ask your doctor or pharmacist for more details. The dosage is based on your medical condition and response to treatment. Some common side effects of Samsca include thirst, dry mouth, loss of appetite, constipation, or weakness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Dehydration is a potential risk, especially if you have persistent vomiting or diarrhea and are unable to drink normally. If you notice symptoms of dehydration such as a fast heartbeat or dizziness/lightheadedness, it's important to contact your doctor immediately. For individuals with severe liver disease, cirrhosis, there may be an increased risk of bleeding from the stomach or intestines while taking Samsca. Notify your doctor right away if you experience symptoms such as black/bloody stools, or vomit that contains blood or looks like coffee grounds. In rare cases, tolvaptan, the active ingredient in Samsca, may cause serious liver disease. Seek medical help immediately if you experience symptoms of liver damage, such as nausea/vomiting that doesn't stop, loss of appetite, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine. While very rare, a serious allergic reaction to Samsca is possible. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Remember, if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to note that treatment with Samsca should be initiated or resumed in a hospital setting for proper monitoring. This is crucial because if your blood sodium level rises too quickly, it can lead to a serious and potentially fatal condition known as osmotic demyelination syndrome. The risk of this condition is higher for individuals with liver disease, poor nutrition, or those who use alcohol. If you experience symptoms such as difficulty speaking or swallowing, mental or mood changes like confusion, weakness, or involuntary movements in the arms or legs, or seizures, it's important to inform your doctor immediately. It's also worth mentioning that Samsca should not be used to treat a certain kidney problem known as autosomal dominant polycystic kidney disease, ADPKD. This is due to the risk of serious liver damage. If you are considering using Samsca to treat ADPKD, it's essential to be enrolled in a specialized program. Be sure to consult your doctor for more details on this. Additionally, it's important to follow the daily dosage and take the medication at the optimal timing as prescribed by your healthcare provider. Before taking Samsca, make sure to inform your doctor about any allergies you may have or if you are allergic to any of the inactive ingredients in the product. Also, discuss your medical history, especially if you have diabetes, liver disease, or trouble urinating. While taking this medication, it's important to stay hydrated by drinking fluids. If you have difficulty drinking normally or recognizing thirst, inform your doctor before starting Samsca. Be aware that Samsca may occasionally increase your blood sugar levels, which can affect diabetes. If you have diabetes, monitor your blood sugar regularly and share the results with your doctor. Your doctor may need to make adjustments to your diabetes medication, exercise routine, or diet. If you are planning to have surgery, it's important to disclose all the medications you are taking, including Samsca, to your doctor or dentist beforehand. If you are pregnant, discuss with your doctor whether the benefits of taking Samsca outweigh the potential risks. It is also important to consult your doctor before using Samsca if you are breastfeeding, as it is not known if the medication passes into breast milk. It's important to be aware of potential drug interactions that could affect how Samsca works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Samsca is desmopressin. Additionally, other medications can affect how Samsca is removed from your body, which may impact its effectiveness. Examples of these medications include azole antifungals, cobicistat, HIV protease inhibitors, macrolide antibiotics, ribociclib, rifamycins, ritonavir, St. John's wort, and drugs used to treat seizures, among others. Be sure to discuss any potential interactions with your doctor before taking Samsca. Remember to follow your doctor's instructions carefully for the best results. If someone has taken too much Samsca and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share your Samsca medication with others, as it is prescribed specifically for you. Your doctor may also request lab and medical tests to monitor your sodium and potassium levels while taking Samsca. Be sure to attend all scheduled medical and lab appointments to ensure the medication is working effectively for you. If you forget to take a dose of Samsca, take it as soon as you remember. However, if it's close to the time of your next dose, just skip the missed one and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It is important to store Samsca at room temperature, away from light and moisture, and not in the bathroom. Keep all medications out of reach of children and pets. Do not flush Samsca down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.